Greetings, and thank you for the opportunity to introduce our Comply Light founding team. We are applying to the NIH Substance Use Disorder Startup Challenge to turn our years of NIH-funded research and real-world experience into a product that improves SUD care while protecting patient privacy. Today, we, the founders, will share who we are, our roles, and why we are ready for this exciting journey. We'll start with our technical lead or hacker, Dr. Adela Grando. Dr. Grando.
Hello, I'm a professor of biomedical informatics at Arizona State University with action appointments at Mayo Clinic. And for more than a decade, my work has focused on granular health data segmentation, interoperability, and patient privacy, especially for sensitive domains like SUD. I'm the principal investigator of the NIDA funded SHARES project, which developed a standard-based EHR-agnostic technology for automating SUD data segmentation. And that work laid the foundation for Comply Light. What drives me towards entrepreneurship is frustration. Frustration that impactful research often stops at publications. And I want to see technology being used, deployed, and trusted in real clinical systems. As a founder, I bring deep experience in system architecture, standard-based design, and translating regulatory requirements into executable logic. And our end user and customer need lead, or hipster, is Dr. Anita Mulko.
Thanks, Adela. I'm a clinical associate professor of biomedical informatics, an entrepreneur, and a board-certified internal medicine physician with over 30 years' experience, including patients with SUD. My role at Comply Light is to keep us focused on solving real clinical and operational problems. I bring a clinician perspective to workflow design, patient trust, consent complexity, and the realities of care coordination under 42 CFR Part 2. What motivates me is seeing how hard my colleagues work to care for patients, often without access to the information they need. Legal and regulatory constraints can make care coordination quite challenging. And that complexity contributes to burnout, fragmented care, and most importantly, missed opportunities to help people with SUD. Adela and I have worked together for over a decade now. We've published extensively and led multi-site projects on sensitive data sharing. But entrepreneurship is essential now to turning this research into practical, privacy-respecting tools that improve the quality and efficiency of frontline everyday care. Now, I'd like to introduce the third member of our team, our business and entrepreneurial lead or hustler, Martha Kaiser.
Thank you. Hello. I have over 12 years of experience in healthcare systems and industry, and I'm a graduate of the ASU Master's Program in Biomedical Informatics and Data Science. I also served as a research assistant on the SHARES project and co-led the NSF iCore customer discovery. My passion for entrepreneurship comes from bridging the gap between innovation and adoption. I've seen how promising technologies fail, not because they lack value, but because they don't align with the customer needs, budget, or workflows. As a founder, I focus on customer discovery, business modeling, partnership, and commercialization strategy. I see this as a first step toward building a sustainable company, not a side project. So you see, we are not a newly assembled team. Each of us has demonstrated grit in different ways, leading multi-year NIH projects through shifting policy landscapes, balancing clinical care with innovation, and doing customer discovery in highly regulated markets. We know entrepreneurship is demanding. This challenge is not exploratory for us. It's intentional. Each team member has planned for the 25 hours per month time commitment, and we are fully aligned in prioritizing this work.
To conclude, we are pursuing Comply Light because people with substance use disorders deserve privacy and high-quality coordinated care. And we are ready to build the company that makes it possible. We are committed to the mentorship, to each other, and to the long journey ahead. Thank you so much for considering our team.